Just got off the phone with a local pulmonologist on the front line seeing all sides of this disease. Dr. Adrian DiVittorio speaking with me right after his rounds at Mobile Infirmary, and here is part of that conversation now.
So the question is, what do we do with these positive COVID tests? Well, if somebody gets tested for COVID-19 without symptoms, then that always poses the question, okay, what do we do with this test now? The responsible, I think the safest thing to do is if somebody tests positive for COVID, is do some type of quarantining in order to, one, make sure that symptoms of COVID-19, such as cough, cold, fevers, gastrointestinal symptoms, don't develop, and likewise decrease the possibility of transmission to somebody who is COVID negative and without symptoms.
So football is a contact sport. There has been mask wearing and practicing of hygiene. Going forward, as teams try to have a complete season, what do you think we can expect to see?
Well, inevitably, as sports, societies, schools, etc., try to get back into the norm, I suspect that there will be a rise in numbers, a rise in cases. Now, a lot of these may be asymptomatic numbers because more and more people are going to be getting tested. But if you put yourself out on whether it be a football field, a stadium, you go to a gathering, there is no question that you are increasing your probability of contracting COVID-19.
As a pulmonologist, what concerns you most with COVID?
Now, some people can get the virus and have a simple cough, cold, or GI manifestation. Some people get COVID-19 and have no symptoms, and then a certain percentage get COVID-19 and either die from it or get profoundly ill and are on mechanical ventilation.
And on that note, what more can we do?
What we do need to do is keep wearing masks. They are working. They are providing effective. One of my fears is that people will get mask fatigue. They'll put it on just to be able to enter the stadium, a facility, and then once they're there, they're going to pull it off and go and pretend nothing's wrong. We need to keep our guard up. We need to keep our mask up. We need to keep frequent hand washing because they are working.
And Dr. DiVittorio telling me he's not surprised by today's announcement. Social distancing, face masks, though, are helping to control the virus, he says. Now it's up to scientists to figure out a safe and effective vaccine.